Healthcare as a summit, as a platform has helped you. You yourself as a doctor, you have seen the key speakers listening, the ministries sharing their thought process, their future roadmap. So how does this healthcare summit help you?
Yeah, I tell you, I'm basically a surgeon, and I've been into surgical field for more than 25 years. And how we develop our surgical skills and surgical knowledge is through having our state conferences or national conferences or sometimes international conferences. That's from where, as a simple surgeon, I've gone on forming a bariatric surgery society of the country and to establish a super specialty, something like bariatric surgery, which was not heard in the country. So this was all through meeting the people and conferencing. Then, in the last 10 years, I'm into building my own hospital and creating the best for mass, for the population. And when I was building the hospital and reaching to people, and then I thought, there was no forum where we can share this kind of knowledge, especially hospital management based, or where you can have a reach to the people. And when in recent few years, when I saw some of these forums, which are talking about management, we are talking about e-health, which are sharing their knowledge about, like ICT, information and communication technology, hospital management systems, and building the hospital, how to make the hospital affordable. And then I thought, this is really the platform. And then I thought it's interesting when people start and get associated.
So now IT and healthcare, they go hand in hand.
Yeah.
So how much do you see the adoption of the technology into the healthcare sector?
See, in fact, this is what I keep talking with my friends. IT as a business or as a knowledge or as a service industry, India is very much leading globally. But unfortunately, where it is most needed in healthcare sector, which is not much seen. Though we have these IT implementation and big, large tertiary or quaternary care hospitals, but where it is really needed, like secondary care hospital, primary care hospital, it's still not there. And in fact, this is what should be the thrust. See, any business which is at the high end, when it is a successful business model, like tertiary and quaternary care hospital, IT is going to come there because they have to sustain with the competition with the global players. But where it is most needed in the secondary care and primary care, it's very important because that is the stage where the data which can be shared with the different networking hospitals or any other service providing industry, which is very important. Today what is happening at primary and secondary care level, there is a duplicity of data. When there is a duplicity of information, if you see one patient, he is shopping from one doctor to other doctor, from one small hospital to another small hospital. And this is where I think IT will be of a tremendous help. So this should be implemented. Unfortunately, it's really not happening. But I just now in the last session I heard some of the states like Tamil Nadu and Rajasthan, even at the public health, they are doing a wonderful job through IT, giving and taking the data, especially like ASHA health workers and the primary health centers. And I think it is way forward. And surely there is a great hope. The people will come up at this primary and secondary care level also to go into the IT.
So you mentioned that you are also building up your own hospital now and working on it. So what are the technicalities of the IT technology that you are taking care of while building up the hospital for yourself? Since you understand the technology. So what are the key focus areas in IT that you will be adding to the hospital?
See, the IT so far, even still, there are many of these hospitals, even in a small second-tier hospital, using it mainly for billing and accounting and registration. But the way beyond, it is for the clinical data. The clinical data, if you take of the patient and it will be stored and it can be shared with the hospital, it will be of the most important. I'll give one simple example. Some patients are not happy with one hospital or with one consultant, they go on taking their ultrasound 5 to 6 times within a year span. They will have a CT and MRI. You know, the advanced technology costs a lot. And if you go on repeatedly doing it, it will cost a lot. But if you have a data sharing, if you can record those data, so IT technology is first and foremost. Second to account and billing, I would like to keep it for the clinical data storage for the patient, which can be utilized and which can be shared with other, not only network hospitals, but even other hospitals also. At the same time, this IT can be used for training. See, the training of the manpower is most important. It is the second most important part of this industry, that you have to keep the people training. See, you have a best skilled surgeon, and you know how long that surgeon can work. 20 years, 30 years, he can't go on working for lifetime, or the second life and second and third generation. So that training part for each and every person is very important. Secondly, the way I used to practice, say 30 to 40 years back, today it's hardly 10 to 20% of the textbook which I have read. So it is all through the training, I have come to this stage. And this is happening to each and every individual who is into this healthcare industry. So they have to keep themselves updated. And this IT will be at a really of help to keep them trained.
Thank you, Sir. Thank you for the inputs.
Thank you.